Go.
Hi, my name is Mallory Stegmueller.
I'm Ellery Parker.
And I'm Abby Snell.
And this is our critical reasoning group dissemination project. And our topic was voice masculinization in transgendered men.
So voice masculinization essentially is a process of changing aspects of one's voice in order to influence the listener to receive a more masculine voice. So as we know, voice is one of the most noticeable traits that plays a central role in gender presentation. So if you identify as female, you want others to receive your voice as feminine. If you identify as male, you want others to receive your voice as masculine. So when your voice and your gender identity do not align, this can cause significant distress. Therefore, transgender men who are experiencing this distress, also known as gender dysphoria, are the most common clients that seek out voice masculinization services. As a result, many seek voice masculinization treatments to bring their speech into alignment with their experienced gender. In terms of how one would achieve voice masculinization, there are two key acoustic characteristics of speech that independently contribute to a masculine sounding voice. One of these is fundamental frequency of vocal fold vibration. So one way to achieve voice masculinization is to lower one's fundamental frequency into a range that is perceived as male, which is about 60 to 180 hertz. Other speech features include the spectral structure of speech formants. So these formants not only give identity to vowels, but they also reflect vocal tract length, and men typically have a longer vocal tract. So there's lots of characteristics that go into one's voice and to make it sound more masculine, but there seems to be a magic combination of lowering one's fundamental frequency and altering speech formants. So voice masculinization can occur one through puberty or through types of treatment. And one of those types of treatment is testosterone therapy. So testosterone therapy essentially is a process that aims to induce and maintain virilization, which is a condition where women develop masculine physical traits like facial hair or voice changes. And they do this through a consistent maintenance of testosterone levels at the male level. So during puberty, the presence of testosterone, it lengthens and thickens the vocal folds, and the larynx lowers, which increases the size of the vocal tract. So essentially the goal of testosterone therapy aims to change aspects of the voice, such as fundamental frequency, sound pressure levels, and voice range to create a more masculine voice, how puberty would. So in terms of who would seek these treatments, again, these are individuals who want to alter their physical appearance and voice to better align their gender identity. There are various types of testosterone treatment. Typically, testosterone treatment is administered through intramuscular injections, or others could receive it transdermally through testosterone gels. There are other oral testosterone, you could take it orally, or there are also implantable pellets that are available. So in terms of what testosterone does to one's voice, what we've seen in our research is that it lowers fundamental frequency, it lengthens vocal cord length or vocal tract length, it can change the phonation frequency. These changes were varied widely amongst participants in the research that we reviewed. And unfortunately, testosterone therapy has some side effects. Many participants experience lots of vocal fatigue, vocal instability, strained voice quality, difficulties projecting their voice, and some of them even complained of sounding too young for their chronological age. So in short, testosterone therapy is a successful treatment for some, but others may be disappointed with the outcomes and may be steered away due to the side effects. But luckily, there are other vocal or voice masculinization treatments that clients can choose from.
All right, so if testosterone therapy is not successful for the client due to side effects, which could be unsatisfactory pitch range, limited changes in vocal tract range, and the other side effects that Abby has already mentioned, an alternative treatment may be considered. One of the alternative treatments an SLP can consider recommending to patients is the Thyroplasty Type 3. So in general, thyroplasty is a type of phonosurgical procedure performed by an otolaryngologist, otherwise known as an ENT. Thyroplasty is a procedure performed to alter the thyroid cartilage in the larynx to change the position of the length of the vocal cords. This is usually performed to improve a patient's voice and ability to cough. There are 4 different types of thyroplasty procedures, and the type 3 is specifically the relaxation thyroplasty. In this procedure, surgeons shorten the vocal folds with the ultimate outcome of lowering the patient's vocal pitch. Patients and healthcare professionals opt to perform this procedure when speech therapy has proven to be ineffective for providing a lowered pitch. So this is often the last resort for many patients. Candidates for this procedure include adults, typically males, who are experiencing high-pitched voice well into adulthood. This is known as puberphonia. Persons with spasmodic dysphonia, and other individuals who have stiff vocal folds resulting in high-pitched, breathy voices. And this information was gathered from the articles Type 3 Thyroplasty for Patients with Mutational Dysphonia by Kazaru Nakamura and others, and the effects of type 3 thyroplasty on voice quality outcomes in puberphonia by Dr. Kaniska Chowhurdy and others.
Abby, did you pause it? As Mallory stated previously, candidates for this procedure may consist of individuals who are resistant to voice therapy and unsatisfied with other less invasive measures like testosterone therapy. In fact, one study found that 31% of participants wanted to pursue additional measures for further masculinization of voice following 9 months of testosterone therapy. Thyroplasty type 3, although less conservative, may be a successful option for this population. Boltnick and colleagues found a drastic reduction in mean fundamental frequency from 154.6 hertz preoperatively to 105.37 hertz postoperatively, objectively indicating a more masculine appearance to the voice. In order to continue to benefit the field of speech-language pathology, future studies should address subjective measures of trans men satisfaction following the procedure, as opposed to objective measures of pitch. We hope this information is helpful. Please pause to check out our sources in the next slide.